Hi, my name is Dr. Greg Doerr, and I am a sports chiropractor. I've actually was fortunate enough to get into the athletic world pretty much within 3 months of graduating from practice, which is when I worked my first sporting event. Obviously, I've been an athlete my entire life at this point, and an aging and retiring athlete from many of my competitive sports, but I still obviously run, play soccer, volleyball when I can, a couple other sports, but I'm also a water guy, paddleboarding, things along those lines. Now, one of the questions that's always asked of me, especially being a sports chiropractor, especially being a lecturer, is how is it that you integrate chiropractic into the athletic world? How is it that you get to that level of expertise that you can actually handle athletic care, and what's the importance of a chiropractor within the athletic world? Now, it's important to realize, again, as a chiropractor, you're part of the sports medicine team, especially when you start getting to higher environments, whether it be high school, college, professional, Olympic levels. You're going to start utilizing more of the sports medicine team. You'll have a role within that environment. A lot of the times within the roles that I've handled on those higher level events, it tends to be more the manipulation, mobilization, taping, soft tissue, and at times rehab based on what's going on and how many physical therapists are around. If the PTs are around, a lot of the times we'll let them do most of the rehab, or the athletic trainers will let them do some of the rehab as well if that's what they want to do within their role. Each time it may be different based on the sports medicine team that you're working. However, what's the easiest way for the chiropractor to get involved in the athletic? First of all, it's education. You have to have a certain expertise in a lot of different areas to really handle sports medicine well, at least the all-encompassing aspect of sports medicine. You need to be able to be a soft tissue specialist. You need to be a rehab specialist. You need to be a taping specialist. You need to be a manipulation mobilization specialist. You need to have a lot of these tools in your belt. You need to be able to discuss nutrition. You have to have this in your belt to be able to have those conversations. Now, the other major aspect is diagnosis. You have to be comfortable actually evaluating these injuries. You need to be able to take some classes on maybe shoulders or knees or something that you may, running classes where it shows you how to evaluate running technique and fix it. These are really critical in becoming what would be a sports chiropractor and making your practice more athletically oriented. Now, I know when I first started, several of my mentors from New Jersey used to say to me, look, if 25% of your practice is athletics, you're in great shape. Now, I have to say, they're right. You're in pretty good shape if you've got 25% of your practice is athletics. But on any given day, I might be 40 to 70% athletics. Now, it doesn't have to be somebody who's playing on an organized team. It could be, one of your senior citizens who might be walking aggressively, or maybe they're biking, or maybe they're playing shuffleboard, or whatever sport activity. I have 75-year-old marathoners. But you need to be able to handle these athletics at a number of different age groups, from the pee-wees all the way up to our senior citizens. The older population is much more active than they've ever been before. Tennis, golf, running, they're all doing these activities. Cycling, weightlifting, swimming, they're all involved in these activities now, and they're doing these to keep themselves younger and healthier for longer periods of time so their bodies don't wear out as quickly. Now, other than the expertise that you need manually and the diagnostic evaluation, movement assessment becomes a critical aspect. As I mentioned before, learning gait analysis, being able to watch somebody run and know if they're running incorrectly and what injuries are going to be associated with it. Learning movement assessments so that you can understand if this shows up, this is a big problem. Now, a chiropractor associated with athletics is going to have a lot of different interventions. It's going to be, again, acute care. The person who sprains their ankle in a soccer game and they're going to show up, you're either working the sideline or they show up in their office in order to get that taken care of. You have to know how to handle inflammation. You need to know how to handle that injured ligament. When it is that it should be referred out for? Do you need to get an x-ray? All of these things are very important if you're going to handle the acute care, especially sidelines. If you can't handle sidelines and know when you have to call the ambulance versus whether or not you can handle it yourself, these are critical things, and a lot of that is done through mentorships. Finding a state association that has a good sports council and being able to spend time with them. That's how I learned it. I was fortunate enough from Bill Bonzel, Ira Shapiro, Len Jaffe, and Len Urshauer and Mark Jaffe. All of those guys took me under their wing and they taught me everything I knew about sports medicine initially. These are things that you should look to integrate within your practice, is find mentors, people who can teach you these things. The other aspect that we're going to do within sports medicine as a chiropractor is, as what I said, movement assessment. Learning to see if there's imbalances within an athlete that may incorporate into an injury later on during the season. So knowing that these imbalances can create, being able to correct these imbalances, whether it's through soft tissue and or rehab techniques. These are critical if you're going to be part of especially the sports medicine groups or teams where your intervention is looking at them and making sure that they don't get injured. And then lastly, of course, it's the chronic injuries that we have to deal with. The patients that may be athletes that have chronic repetitive injuries. Maybe they've fractured, maybe they've had surgery. These are things that are not going to change. The surgeries happen, their mechanics are going to be different. They've had a fracture, their mechanics are going to be different. So a lot of the time, it's continued care through season to make sure that they can actually keep performing and perform at a higher level every single time. You never want to see somebody start the season at their highest performance. They should be peaking towards the end of their season. And a chiropractor's role is making sure they can work at peak performance through maximum enhanced recovery. And that's actually one of my big logos, my big mottos is enhancing recovery for peak performance. That's one of the major things that we do in our office.